Welcome to this video on the history of emotional freedom techniques, EFT. I'm Tania A. As future EFT therapists, it's important to understand how this powerful method bridges ancient healing traditions with modern therapeutic innovation. Today, we'll trace EFT's roots and evolution to help you appreciate its credibility and potential as a transformative tool. Emotional freedom technique, or EFT, is a therapeutic approach that combines cognitive methods with physical tapping on acupressure points. It is an effective tool for relieving emotional distress and promoting healing. As an EFT therapist, you'll work with clients to address various issues by balancing the body's energy system, a practice deeply rooted in ancient healing traditions. As therapists, understanding EFT's ancient origins can enhance your ability to explain its credibility to clients, which is crucial. Energy therapy has existed since the beginning of human history, with many cultures worldwide using rhythmic and physical practices to harmonize mind and body. What's remarkable is that these techniques were developed independently when there was no internet or global communication. This shared discovery of energy healing power shows how intuitive and essential these methods were to human health and well-being throughout history. The Bantu-speaking people trace their origins to southeastern Nigeria and Cameroon around 3000 BCE. Their migration, known as the Bantu expansion, represents one of African history's most significant movements of human culture. Over several millennia, these communities spread across sub-Saharan Africa, reaching regions as far south as present-day South Africa and east as Kenya and Tanzania by 1000 CE. They carried innovations such as agriculture, ironworking, and a wealth of spiritual traditions with them. Among these traditions were holistic healing practices like rhythmic drumming and body tapping, which were central to their approach to health and well-being. These techniques were designed to balance physical, emotional, and spiritual energies, connecting individuals to the community and ancestral lineage. Energy therapies weren't just used in the African continent. The Inuit or Eskimo communities also demonstrate their ancient use of these types of therapies. Body tapping was integral to their healing traditions, addressing emotional and physical imbalances. These practices were interwoven with their survival-focused lifestyle and oral traditions, emphasizing harmony with their environment. They reflect an early understanding of how intentional physical intervention could restore balance and support well-being in challenging conditions. In 1991, the discovery of a 5,000-year-old mummy in the Austral Alps in Europe revealed tattoos aligned with acupuncture meridian points. Known as Otzi the Iceman, this finding demonstrated that ancient cultures had a sophisticated understanding of energy pathways. As EFT therapists, this historical connection strengthens the credibility of tapping on meridian points for healing. The foundational principles of the meridian system were documented over 2,000 years ago in the Huangdi Neijing, the Yellow Emperor's Inner Classic, a key text compiled between 300 BCE and 200 CE. This text outlined the flow of qi, energy, through 12 primary meridians and described how blockages in energy flow could lead to disease. While the documentation dates back 2,000 years, the practices themselves are believed to have originated over 5,000 years ago, evolving from early Chinese healing techniques that sought to balance energy for health and harmony. Before the resurgence of interest in traditional healing in the 1970s, traditional medicine had experienced a significant decline due to multiple historical and cultural factors. With the rise of modern biomedicine in the late 19th and 20th centuries, scientific advancements like germ theory, antibiotics, and vaccines solidified Western medicine as a dominant healthcare system. Reports like the Flexner Report of 1910 restructured medical education in the US, favoring science-based methods and pushing holistic and traditional approaches into obscurity. Simultaneously, colonial powers actively suppressed indigenous healing practices in many parts of the world, labeling them as superstitious or unscientific. These efforts, coupled with urbanization and the growth of centralized hospital systems, further marginalized traditional community-based therapies. Cultural perceptions also shifted. As industrialization emphasized progress, traditional medicine was often dismissed as backward or primitive. Governments and organizations like the World Health Organization, the WHO, promoted modern healthcare, discouraging the use of older traditional practices, even in regions where they were deeply rooted. However, by the 1970s, a growing dissatisfaction with synthetic drugs and a renewed interest in holistic health began to shift public perception. This culminated in events like Richard Nixon's 1972 visit to China, which drew global attention to acupuncture and other traditional Chinese medicine practices. This revival opened the door for innovative energy therapies, paving the way for Dr. Roger Callahan's breakthrough with thought field therapy, TFT. California became a hub for alternative medicine during this period. Dr. Roger Callahan, a clinical psychologist based in California, was driven by a desire to find more effective ways to help his patients. Dr. Callahan was inspired by acupressure's focus on stimulating energy points to restore balance in the body. Intrigued by its potential, he studied this technique alongside the emerging field of kinesiology, which connected physical muscle responses to emotional and energy imbalances. Dr. Callahan worked with a patient named Mary, who had suffered from a debilitating water phobia for decades. Despite trying numerous traditional therapies, her condition persisted. One day, Mary mentioned feeling nauseous when thinking about water. Drawing on his knowledge of acupressure, Dr. Callahan instructed Mary to tap beneath her eye on a point linked to the stomach meridian. To his surprise, and Mary's surprise, Mary's phobia disappeared almost instantly. This led to his development of thought field therapy, TFT, the precursor to EFT. TFT used precise tapping sequences on specific meridian points to address emotional distress and energy imbalances. This structured approach allowed clients to target specific emotional issues by addressing the thought field or the energetic signature of memory or fear. TFT was revolutionary, blending ancient energy practices with modern psychological insights to achieve rapid emotional relief. Dr. Callahan's groundbreaking work in TFT in the 1980s laid the foundations for future energy therapies. Gary Craig, a Stanford-trained engineer with a passion for self-development, became a student of Dr. Callahan. After learning TFT, he simplified it into a universal tapping protocol to make it accessible to everyone. In the 1990s, he developed EFT by combining tapping on key meridian points with affirmations. By 1995, Gary Craig had published the EFT manual, making this groundbreaking therapy available to the world and to you as future therapists. In the late 1990s, Gary Craig took EFT into the Veterans Administration Hospital in California to work with veterans suffering from severe post-traumatic stress disorder. His research demonstrated significant reductions in flashbacks, anxiety, and hypervigilance after just a few sessions. This work not only validated EFT's effectiveness, but also inspired further studies. Many of the veterans at the hospital had been suffering for decades, conventional treatments unable to help alleviate their symptoms. As EFT gained global popularity due to its simplicity and effectiveness, a large body of scientific research emerged to validate its therapeutic value. Studies have confirmed EFT's abilities to reduce cortisol levels, reprocess traumatic memory, and improve emotional regulation. Recognized as effective for post-traumatic stress disorder, anxiety, depression, and chronic pain, EFT provides you with a proven tool to help clients achieve lasting change. EFT has grown into a global phenomenon, practiced by therapists, coaches, and healthcare providers worldwide. Its accessibility and effectiveness have transformed it into a trusted method for emotional and physical well-being. As you embark on your journey as an EFT therapist, you're joining a vibrant, worldwide community of healers. EFT represents a profound leap in the accessibility of energy therapies. Its simplicity, effectiveness, and adaptability have made it a global phenomenon, yet EFT itself continues to evolve. Ongoing research, advancements in neuroscience, and practitioner innovation ensure that EFT remain at the forefront of holistic healing. As future EFT therapists, you're part of this living tradition, bringing wisdom with modern science to empower individuals and transform lives worldwide.